In this video, we are going to learn about mediastinum. The topics which we cover in this video are introduction about mediastinum, its boundaries, divisions, and we'll see in detail about each part of mediastinum: superior mediastinum, anterior, middle, and posterior mediastinum. Mediastinum. It is the middle space left in the thoracic cavity in between the lungs. It is the middle space left in the thoracic cavity in between the lungs. Now let's see the boundaries. You can see here anteriorly there is sternum. Anteriorly sternum. Posteriorly vertebral column. Superiorly thoracic inlet. Superior thoracic inlet. Inferiorly diaphragm. On each side mediastinal pleura. Superiorly thoracic inlet, anteriorly sternum, posteriorly vertebral column, inferiorly diaphragm, on each side mediastinal pleura. Now let's see the divisions of mediastinum. Mediastinum is divided into superior mediastinum and inferior mediastinum. Mediastinum is divided into superior mediastinum and inferior mediastinum by an imaginary plane extending from sternal angle in front to lower border of fourth thoracic vertebra posteriorly. You can see the imaginary plane. It is extending from sternal angle anteriorly. Sternal angle is present at the junction of manubrium sterni and body of sternum. Imaginary plane is extending from sternal angle anteriorly to the lower border of fourth thoracic vertebra posteriorly, or intervertebral disc between T4 and T5 vertebrae. You can see that there are three parts within the inferior mediastinum. Inferior mediastinum is further subdivided by pericardium into three parts. The part of inferior mediastinum in front of pericardium is anterior mediastinum. Pericardium and its contents constitute middle mediastinum. The part of inferior mediastinum behind the pericardium is the posterior mediastinum. Inferior mediastinum is divided into anterior, middle, and posterior mediastinum. In front of the pericardium, anterior, pericardium and its contents, middle, behind the pericardium, posterior mediastinum. Now let's see in detail about each part of mediastinum. First, let's see superior mediastinum. Boundaries of superior mediastinum. You can see this is superior mediastinum. Anteriorly we have manubrium sterni. Posteriorly bodies of upper four thoracic vertebrae from T1 to T4 vertebrae and intervening disc. Superiorly superior thoracic inlet. Inferiorly imaginary plane extending from sternal angle in front to lower border of fourth thoracic vertebra behind. Contents of superior mediastinum. Regarding contents of superior mediastinum, remember arteries, veins, nerves, muscles, and lymphoid organs and lymphatics, and two tubular structures. If you observe the contents of superior mediastinum, you are able to see two tubular structures, one is trachea and the other is esophagus. Regarding arteries, arch of aorta and its branches. Arch of aorta and its branches. Arch of aorta gives brachiocephalic trunk, left common carotid artery, left subclavian artery. Arch of aorta gives brachiocephalic artery, left common carotid artery, left subclavian artery. Regarding veins, upper half of superior vena cava. Superior vena cava is formed by the union of right and left brachiocephalic veins. Into the left brachiocephalic vein, left superior intercostal vein drains. Arch of azygos vein, it opens into superior vena cava. Upper half of superior vena cava, right brachiocephalic vein, left brachiocephalic vein. Into the left brachiocephalic vein, left superior intercostal vein drains. Arch of azygos vein opens into superior vena cava. Regarding nerves, right and left phrenic nerves, right and left vagus nerves, cardiac nerves of both the sides, left recurrent laryngeal nerve. Right and left vagus nerves, right and left phrenic nerves. Right phrenic nerve passes along the right side of right brachiocephalic vein, along the right side of superior vena cava, along the right side of right atrium. Left phrenic nerve, it passes over left ventricle. Left recurrent laryngeal nerve. It is a branch of left vagus nerve. Cardiac nerves of both the sides. Muscles, sternothyroid, sternohyoid, longus colli. If you observe here, sternohyoid and sternothyroid, they are taking origin from posterior surface of manubrium sterni. So they are also the contents of superior mediastinum. Lymphoid organs and lymphatics. You can see the superior mediastinum, thymus, and thoracic duct. Thoracic duct passes through superior mediastinum. It lies within superior mediastinum. Thymus, thoracic duct, and lymph nodes. Lymph nodes are present in every part of mediastinum. So you can write the lymph node as a content in every part of mediastinum. Trachea, esophagus, arch of aorta and its branches, upper half of superior vena cava, right brachiocephalic vein, left brachiocephalic vein, left superior intercostal vein, arch of azygos vein, nerves, right and left phrenic nerves, right and left vagus nerves, left recurrent laryngeal nerve, cardiac nerves of both the sides, muscles, stenothyroid, stenohyoid, lagomoscoli, lymphoid organs and lymphatics, thymus, thoracic duct, and lymph nodes. Next, we are going to see about anterior mediastinum. Boundaries of anterior mediastinum. Anteriorly, body of sternum. Posteriorly, pericardium covering the heart. Imaginary plane extending from sternal angle anteriorly to lower border of fourth thoracic vertebra posteriorly. Inferiorly, diaphragm. On each side, mediastinal pleura. For every part of mediastinum, on each side there is mediastinal pleura. Contents of anterior mediastinum. You are able to see two ligaments here. Sternopericardial ligaments connecting the sternum and pericardium. Sternopericardial ligaments. This is present superiorly. Superior sternopericardial ligament. It is present inferiorly. Inferior sternopericardial ligament. Superior sternopericardial ligament. Inferior sternopericardial ligament. Mediastinal branches of internal thoracic artery. Lymph nodes. Loose areolar tissue. And you are also able to see some part of thymus. Lower part of thymus is present in anterior mediastinum. Superior and inferior sternopericardial ligaments, lymph nodes, mediastinal branches of internal thoracic artery, loose areolar tissue, lower part of thymus. Middle mediastinum. Boundaries of middle mediastinum. Anteriorly, anterior mediastinum. Posteriorly, posterior mediastinum. Superiorly, superior mediastinum. Inferiorly, diaphragm. Contents of middle mediastinum. Pericardium, heart. Heart. Next, remember arteries, veins, nerves, lymph nodes. Arteries. Ascending aorta, pulmonary trunk dividing into two pulmonary arteries. Ascending aorta, pulmonary trunk dividing into two pulmonary arteries. Right pulmonary artery, left pulmonary artery. Lower half of superior vena cava, right and left pulmonary veins. Lower half of superior vena cava, right pulmonary veins, left pulmonary veins. Pulmonary veins opens into atria of the heart. Phrenic nerves, deep cardiac plexus. You can see two nerves here. Right phrenic nerve, left phrenic nerve. Right phrenic nerve passes along the right side of right atrium. Left phrenic nerve passes lateral to left ventricle. Lymph nodes. Tracheobronchial lymph nodes. Bifurcation of trachea. Right and left principal bronchi. At the level of sternal angle, trachea bifurcates into right and left principal bronchi. Ascending aorta, pulmonary trunk dividing into two pulmonary arteries, right pulmonary artery and the left pulmonary artery. Veins, lower half of superior vena cava, right pulmonary veins, left pulmonary veins. Nerves, phrenic nerves, right and left phrenic nerves, deep cardiac plexus, lymph nodes, tracheobronchial lymph nodes. Remember this word tracheobronchial. When you remember this, immediately you remember trachea, bifurcation of trachea, and bronchial, right and left principal bronchi. Posterior mediastinum. Boundaries of posterior mediastinum. Anteriorly, pericardium, pulmonary vessels. Bifurcation of trachea, posterior part of upper surface of diaphragm. Pericardium, pulmonary vessels. Trachea bifurcates here. Bifurcation of trachea. Posterior part of upper surface of diaphragm. Posteriorly, lower right thoracic vertebrae and intervening disc. Posteriorly, you can see lower right thoracic vertebrae and their intervening disc. Superiorly, imaginary plane joining the sternal angle anteriorly and lower border of fourth thoracic vertebra posteriorly. Inferiorly, diaphragm. Contents of posterior mediastinum. You can see one tubular structure here, esophagus. Next, remember arteries, veins, nerves, lymph nodes, and lymphatics. Descending thoracic aorta and its branches. Veins, azygos vein, accessory hemiazygos vein, hemiazygos vein. Nerves, vagus nerves, splanchnic nerves arising from sympathetic trunks. Sympathetic trunk. You can see three splanchnic nerves which arise from ganglia of sympathetic trunk. greater splenic nerve, lesser splenic nerve, least splenic nerve. Lymph nodes and lymphatics, thoracic duct, posterior mediastinal lymph nodes. Let's revise the contents. Esophagus, descending thoracic aorta and its branches, azygos vein, axillary hemiazygos vein, thoracic duct, posterior mediastinal lymph nodes, nerves, vagus nerve, sympathetic trunks. From the sympathetic trunk, splenic nerves, greater, lesser, least splenic nerves. Let us now revise the contents of mediastinum. Contents of superior mediastinum, trachea, esophagus, arch of aorta and its branches, upper half of superior vena cava, right brachiocephalic vein, left brachiocephalic vein, left superior intercostal vein, arch of azygos vein, nerves, right and left vagus nerves, right and left phrenic nerves, left recurrent laryngeal nerve, cardiac nerves of both the sides, lymphoid organs and lymphatics, thymus, thoracic duct, and lymph nodes. Muscles, sternothyroid, sternohyoid, longus colli. Contents of anterior mediastinum, superior and inferior sternopericardial ligaments, mediastinal branches of internal thoracic artery, loose areolar tissue, lymph nodes, thymus, lower part of thymus. Contents of middle mediastinum, pericardium, heart, arteries, ascending aorta, pulmonary trunk dividing into two pulmonary arteries, right pulmonary artery, left pulmonary artery, veins, lower half of superior vena cava, right pulmonary veins, left pulmonary veins, nerves, right phrenic nerve, left phrenic nerve, deep cardiac plexus, lymph nodes, tracheobronchial lymph nodes, bifurcation of trachea, right and left principal bronchi. Contents of posterior mediastinum, esophagus, descending thoracic aorta and its branches, azygos vein, accessory hemiazygos vein, nerves, vagus nerves, sympathetic trunks. From the sympathetic trunks, splenic nerves, greater, lesser, and least splenic nerves, lymphatics, thoracic duct, posterior mediastinal lymph nodes.